Hi, I'm Maddie. I'm a senior biology and health studies major on the pre-PA track. I am also a pre-health ambassador.
Hi, I'm Emma. I'm a biology and psychology major. I'm a senior, a pre-health ambassador, and I'm pre-PT.
Hi, my name is Doria Centennial. I'm on the pre-PT track as senior kinesiology major, and I'm a pre-health ambassador.
We're going to be interviewing Derric. He's a first-year PA student. We're just going to ask him a couple questions about PA school. So, Derric, can you please introduce yourself and tell us about where you're attending school right now?
Yeah. Hi, guys. My name is Derric Vigeant. I am a first-year PA student at Bryant University. I'm a recent graduate of the University of Rhode Island. Actually, I graduated in the class of 2019 here with a major in kinesiology. So I'm about 7-ish months into my program right now with probably 2 years to go, 3 more months of clinical rotations, and then 15 months of, 3 more months of didactic year and 15 months of clinical rotations. So I still have a little bit to go, but it's going pretty well so far.
Cool. So what made you want to pursue a career as a PA?
So actually, when I first came to URI, I had the plan to go pre-PT. That's why I kind of came in as a major of kinesiology. I just started to do more research on my own, and freshman year I landed a job at Butler Hospital in Providence, Rhode Island, as an intake coordinator. So I worked in the psychiatric emergency room there, and I had a couple PA coworkers there, and they spoke really highly of the profession, and I did a lot of research on my own and just kind of saw that the PA route was a little bit better than the PT route in regards to specializing in different fields of medicine and pay outcomes, and the sort of autonomy that we're able to use in practice. I think PAs have the ability to do pretty much everything that a doctor can do under their supervision, as well as work in surgery. And that's one big thing that kind of drew me to the PA profession. I have a strong interest in pursuing a career in some surgical field, so that's kind of what I want to do.
Well, you answered a little bit of the next question, which is how did you gain patient care experience? Which
Sure.
is a job, but how else?
Yeah, so obviously I'll talk a little bit about Butler Hospital first. It's kind of like a job that sort of no one in my class really worked in psych before school, but I gained about 2,000 hours of experience at Butler Hospital, and then 2,000 hours of experience through URI EMS working on the rescue here. But most students typically pursue jobs in as EMTs, ER techs and stuff like that. But I think finding a job in something that's kind of that still qualifies as patient care, but is sort of different than most other applicants is kind of a step up in, how to help you get into PA school and help you excel in, PA school interviews and stuff like that. It makes you stand out as an applicant. So working in psych was a pretty cool field, and I definitely recommend it for people who kind of don't know exactly what they want to do yet.
And how is the schoolwork different than undergrad? And how has the pandemic affected that?
So PA school is just a whole nother ballgame. So URI was pretty much come to classes, come home, maybe study a little bit, study the night before an exam. That's kind of how I did things in undergrad, but PA school is pretty much more than a full-time job. So we're there pretty much 8 a.m. to 5 p.m.-ish on a regular day, and a lot of the times it usually goes over that. And then we spend the rest of the night completely studying for exams. So I've probably had close to 50 exams in my time at Bryant so far. And that averages out to at least 1 or 2 exams a week. And it's definitely a lot harder than undergrad, but I think anyone that pursues a career and chooses to go to PA school is going to love every second of it, because it's exactly what you want to, learn in school. URI, you're taking classes sort of, just to get your degree, and, PA school, I'm taking classes that everything I'm really interested in pretty much. In regards to the pandemic, so my first term at Bryant was completely on campus. Come second term is when sort of, the COVID pandemic hit, and we went completely online for our second term. Third term, we finally came back to campus. I think we were one of the first schools in the area to completely, be back on campus. And I was actually able to see some patients in that time when I came back to campus third term. So we volunteer at like the Rhode Island Free Clinic as well as Clinica Esperanza in Providence. And I think that kind of gives us an edge over some other schools right now that are going through this, as they're pretty much all on Zoom and they do Zoom patient interactions and stuff like that. And it's really not the same because you get most of your learning and experience through seeing patients in person. And I think that's sort of what sets you apart from other schools. And I think it's really great what our school has been able to do to get us back. And especially our clinical year class, the class above us has, returned to their clinical rotations, while some other schools are doing like online rotations or have completely stopped them in general. So, I'm excited to be a part of Bryant in general.
And it's Rhode Island, your home, right?
That's it. Venue. Life, I care after school.
And what's your favorite thing about PA school?
Honestly, Bryant has picked like a class to pretty much, make every student kind of fit in and click, to the best of their abilities. And I think the people that you're with really makes a difference while you're going through school. I mean, it's definitely one of the toughest times of your life, and to meet people and have students there that are like similar to you and are going through the same process. I think it's good to have like a strong backbone of people who can sort of like accommodate your ways to study and find different ways to do things. And sometimes you just have to stay sane and hang out with people in the class after and just avoid studying in general. And I think it's important just to have a group of people that you feel comfortable around, and you could sort of, have some fun sometimes.
Good. Okay. I think that's all the questions we have.
Yes.
So we just want to thank you for joining us today. And
Sounds
good luck with PA school.
Thank you guys. Good luck to you.
Thank you.